Hi, Clement speaking from Admissio. In health projects in the Global South, the provision of pharmaceuticals is an issue. The approach is very often to promote the use of essential medicines. And I want to share with you websites where you can inform yourself about essential medicines. Here I am in my Google search engine and I type in and I recommend to look for essential medicine list. Okay, here is the search, and this leads me to the essential medicine website. I get information about the model list of essential medicine, but the database is also on a separate website. So I click on this link and I'm guided to the model list of essential medicine. Here I can browse the EML different sections and I can, for instance, look for antibiotics. Separated the list into access group, watch group, and reserve antibiotic. So if I click on the access group and apply the filter, I see the different antibiotics which WHO recommends to have. If I want to see reserve antibiotics, the watch group, I apply the filter and I get this one. So let's look for specific drugs, for example, ampicillin. And I can see in this section that it belongs to the access group antibiotics, that there is a parenteral use, and it's the first choice antibiotic for different pathologies, and it's the second choice antibiotic for meningitis. If I need more general information on antibiotic, on ampicillin, I click here and I learn about the EML status history, and I get more information using the drug bank. So if I click here, another website opens and I get more scientific information about the indication. For example, ampicillin can be used in respiratory tract infection, gastrointestinal infections, urinary tract infections, and meningitis. The sensitive bacteria are also mentioned. We see the associated conditions when it can be used. We learn about the pharmacodynamics, the mechanism of action, the absorption. Unfortunately, if I want to go or be informed about adverse effects, I need to subscribe to another database, and this one is no free of charge. But as I mentioned, this is a first overview for the drug. I can recommend also to look into the Wikipedia section of ampicillin, and here again I see the diseases that ampicillin is used, the available forms, contraindications are mentioned, interactions, the history, the cost, and with regards to antimicrobial resistance, I realized that ampicillin finds also or is used by veterinarians to treat animals, and so this is another way of creating antimicrobial resistance. The drug bank database mentioned. Let's browse for others. We recently had a discussion on chloramphenicol. Here is more information on chloramphenicol as a broad-spectrum antibiotic. The indication for cholera, it destroys the vibrios. It's sometimes associated in skin infection and so on and so forth. Another website which I can recommend is drugs.com. Here, for example, if I look for sulfamethoxazole trimetoprim, I get a general information. I also recommend the author. Here is prescribing information from the Food and Drug Administration in the US. There is a service called Pill Identifier, and there is a drug interaction information concerning sulfamethoxazole. So let the general information. So what is sulfamethoxazole? The warnings, what needs to be done before taking the medicine. So so caution about liver disease, kidney disease, in case of anemia caused by folic acid deficiency. I need to be careful. There is more information on associated diseases where I have to talk to my doctor. So from this, you can learn that this is mainly the patient information, what the side effects are mentioned, and the other drug interactions. So patients are very much informed. So if I want to get for the health advisor, I go back and look for health professionals, and then I again search for sulfa methoxazole trimethoprim, and then I get the professional information or prescribing information from FDA. Let's look what we can find in the professional information. Here is the dosage, the interactions, the warnings, or let's check, for instance, pregnancy consideration. So there is an increase for congenital malformation, which is described in research. However, sulfamethoxazole trimethoprim is in many countries a prophylactic treatment for malaria. Finally, task cards in infection clinical management. You see the different recommendations, and there again click on model list and you will find the model list. I hope you find this helpful and thank you for watching. Bye, see you next time.